we're going to look at the IVU. IVU stands for the Intra Venous Urogram. So the intravenous urogram and some conditions, some associated conditions. So how do they appear? This is what we are going to look at. So to begin with, we are going to ask some questions. The first question being, what is the finding in case of the duplex? The duplex kidney. The second question will be, how does the ureterocele, how does it appear? So in this video, we'll find out the answers to these questions and learn in detail. So first we are going to start with the medullary sponge kidney. The medullary sponge kidney. So the medullary sponge kidney is nothing but it is a bouquet of flowers. It is a bouquet of flowers appearance. So when you look, it looks like this. Bouquet of flowers, right? There are some flower like. So this is how it looks on IVU. So it is also known as a paintbrush. It is known as a paintbrush. Paintbrush appearance. And it refers to a cystic dilation of the distal collecting tubules. It often refers to the cystic. There is a cystic dilation of the distal convoluted tubule. The distal collecting tubules. Next, we move on to the duplex kidney. So, what is the duplex kidney? So, just to draw the diagram, it looks like this. Okay. So, what does this signify? It is nothing but a drooping lily sign. There is a drooping. There is a drooping lily sign. And what does this refer to? It refers to the inferolateral. So it refers to the inferolateral displacement. So it refers to the inferolateral displacement of the lower lobe of the lower pole due to the obstructed upper pole. So there is an obstructed upper pole in the duplicated collecting system. In the duplicated collecting system. Next, we look at the horseshoe kidney. So, under the horseshoe kidney, there is something known as a handshake sign. Okay, this is the handshake sign. So, there's something known as a handshake sign. So, this handshake sign is nothing but it is due to the position of the lower poles closer to the spine. So, the lower poles, they are very close, they are close to the spine. And also the lower calyces are closer to each other. The lower calyces, they come closer, they are closer to each other. So there is also something known as the flower vase sign. The flower vase sign. So the flower vase sign is due to the medially rotated calyces. So it is the medially rotated the calyces. Then we move on to the retroperitoneal fibrosis. So under the retroperitoneal fibrosis, So under this, we need to know there is a maiden waist deformity. There is a maiden waist deformity. And it refers to the medially drawn uretus. So it is nothing but the medially drawn uretus. Medially drawn uretus. And it is caused by the fibrosis. It is caused by the fibrosis at the lumbosacral junction. Next, we look at the retrocaval ureter. So the retrocaval ureter. So under the retrocaval ureter, we need to know it is a fish hook. That is, it forms like this. So it is nothing but a fish hook. The fish hook or the reverse. It is also known as the reverse J. Reverse J deformity. And here the right ureter, it hooks behind the IVC. The right ureter, if you see, it hooks behind the IVC as it passes posterior to it. It passes posterior, that's when it hooks behind the IVC. Then we look at the ureterocele. So what is the ureterocele? So under the ureterocele, it is cobra head. So what do you mean by cobra head? So this is how it looks. So this is the cobra head. So there is a cobra head or the adder head appearance is what is seen. And next is, it refers to the dilation of the distal ureter. It refers to the dilation of the distal ureter. Next, we look at the transitional cell carcinoma. So what is a transitional cell carcinoma? So we are going to look at the transitional cell carcinoma of the ureter. So here there is something known as the goblet sign. Something known as the goblet sign. Goblet sign, and this is due to the focal dilation. The focal dilation of the ureter. Of the ureter, and this is by an intraluminal mass. Now we'll move on to answering our questions. So the very first question we asked was, what is the duplex? The duplex kidney. So what are the signs seen in the intravenous urogram? So it includes, it is a drooling. There is a drooling. There is a drooping lily sign. This is a very significant and a very first keyword of this duplex. So D and D. D stands for the drooping lily, and it refers to the infero. There is a inferolateral. There is a inferolateral displacement of the lower pole, and this is due to an obstructed. It is due to an obstructed upper pole. Due to an obstructed upper pole, and this is in a duplicated collecting system. In a duplicated collecting system. So it is a duplex kidney, it is a drooping lily sign, there's an inferior displacement of the lower pole by the obstructed lobe, obstructed pole due to the duplication of the collecting system. Next, the question we asked was, what is a ureterocele? So uretero. So as this is very important, that is first thing we have to, the image should flash in our mind. So this is how the ureterocele looks. That is a cobra. The cobra or the adder head, cobra or the adder head appearance. And it also refers to the dilation of the distal ureter. There is the dilation of the distal ureter.